arthritis, they need pain management, just a multitude of things. And where we can bring in not only nursing, but physical therapy, occupational therapies, speech therapists, home health aides, and of course, social workers who are extremely important in providing resources for the family. Our third program that we have, and that is the one where I manage, is called the Private Duty or the Private Care Program. And that's where we provide services for a client in their home. First of all, we need to deem that they will be safe in their home. Many of them live alone. They are older adults. Some of them do have a spouse who is also, about their age, and they have their own medical issues or health problems. And the client, of course, does not want to leave their home setting where they feel so very, very comfortable. They're used to their neighbors around, the school bus coming by to pick up children in the neighborhood, the mailman coming, all those things that are comfort at home. With their little garden and the flowers around the house and so on. They just do not want to leave. However, in order for them to stay safely in their home, they need some help. And they may not have a sufficient family in the community. A lot of the adult children are, we call them in the sandwich era, where they both are working full-time, husband and spouse, they have young children in school, and they become very, very busy with that alone and are feeling guilty because they're not able to help mom and dad like they would like to. I also see clients who have adult children who live out of the metro area, who actually live out of state. I have many of those who I work and advocate for and manage their services in the home. One of the things that I can provide in my program is some private duty help. And of course, this is paid for by the patient. We also have several individuals who have long-term care insurance, and they are paid for services in the home. Also, the VA, Veterans Administration, has a community health program where they provide respite in the home up to 6 hours a day. I have several patients that are currently on that program. So we try to look for a lot of services, to help the caregiver. Some of those services, if I can proceed, would be a nurse, myself, where I come into the home and do a total assessment. And by that I mean a physical assessment of the client to deem if indeed they are safe in their home environment. I not only look at the patient, but I look at the environment they're living in. What can we do differently to make it more safe? And I also look at the willingness and ability of the caregiver. Does the caregiver have some dementia? Are they going to remember to give medication reminders? And if there's a fire, are they going to be able to get out of the home safely? Are they going to know what to do? So what I do as a nurse coming in, I set up a plan of care. And that may involve me setting up their medication, returning in a week or two to see if they're managing that medicine okay, assessing how they're responding. I check their blood pressure, I do weights, I do oximeter checks to determine their oxygen concentration. Some of them are pretty severely compensated with respiratory problems. Let's see, I do labs. Lots of times they're unable to get into the clinic, or the adult child has to take their day off from work in order to get mom and dad into the clinic for their labs. So I do all those, and I follow up on the results of those and intervene in terms of what needs to be done. So I'm in close contact with their physician all the time. We also provide home health aides in the home. May come in just, for a few hours one day a week. Generally, it's for a bath. We try to put safety equipment in place as well to help the caregiver. That might be, a commode or a bath bench or tub railings. We let them know where things should be placed, how to move furniture, just a multitude of things in order to help the caregiver and take the stress off of that caregiver. We also provide homemaking services vacuuming, cleaning, we do shopping, we have home health aides that will accompany a patient to the physician. We do a lot of that, especially for our out-of-metro, out-of-state adult children, and follow up with them closely in that regard. We try to put other services in place, which I think some of the other panel will be alluding to. Setting up Lifeline, I think, is extremely important that there's a lifeline in place. It's fairly not costly, $1 a day for that security, to know that your loved one has, just at the push of a button, can get help. We bring in Meals on Wheels. We should suggest daycare services. There's just a lot of things that we can do to take some of the stress off the caregiver. And what the literature says, caregiving it's a very difficult job. They say, really 8 hours a day is enough as a caregiver. You need to take care of yourselves. It is so, so important. And, I think you need to maintain balance. You certainly need to stay connected with your family, friends, neighbors, your church. Those are all resources that you can bring in to give you some respite and relief so that you can do some things for yourself. It's very, very important. And I can tell you many instances in my years of case managing at home health where the caregiver has been reluctant to accept services. They just felt they needed to do it all. And that is the individual that ends up being hospitalized, who actually dies in the home or in the hospital, just because they're simply stressed and overwhelmed. Leads to depression, it leads to medical illnesses, it might lead to use of alcohol